This is Up to Date on KCUR 89.3. I'm Brian Ellison. It's no longer a surprise to hear that long-standing federal grants are being cut under the Trump administration, especially in the area of scientific and medical research. Last week, Health and Human Services Secretary Robert F. Kennedy Jr. canceled nearly $500 million in contracts with universities and private companies to develop new uses for mRNA technology. That's what's behind the most common COVID-19 vaccines, credited with saving millions of lives. The funding would have developed more mRNA vaccines, and to learn more about what that means for potential treatment of infectious diseases, known and not yet known, going forward, is Dr. Sarah Boyd, infectious disease specialist with St. Luke's BJC Health System. Welcome back to the program, Sarah.
Thank you for having me again.
I'm going to call you Dr. Boyd, actually, since that's who you are. Help us understand a little bit about this terminology, mRNA. What do those letters stand for, and what does this mean?
Right. So mRNA, the M stands for messenger, and RNA stands for ribonucleic acid. So you can obviously see why we abbreviate it to mRNA.
We'll stick with mRNA, but messenger is interesting.
Yes. So basically, that's a message that's carried in our cells, and all cells have that. That's how they transmit information. But pathogens or germs also do, and that's the technology behind why they utilized it and looked at it for vaccine research.
So just so everyone's on the same page, how do these work? I mean, what is it that was so unique or special when mRNA vaccines were first developed?
So mRNA vaccines had been researched and felt a potential option for vaccine development since the 70s. But the first two vaccines utilizing that technology were used during COVID-19 pandemic.
So this research had been going on for a long time, but there finally came a situation that required using them.
That needed to use it. And I think it's important to talk about just what a vaccine is. And a vaccine is basically using any there's different methods, so mRNA is one, an activated virus, but it's anything that we use to sort of train the immune system to fight off an infection.
Okay, so say more about that. I mean, how is that different than how other vaccines work? Because I sort of have had the general impression that vaccines work by sort of alerting, preparing your body for infections to come in. How is this different?
So it basically is the same way. It's just a different mechanism of how it lets the immune system sort of know. And so for COVID-19 vaccine, they utilized a very small area of mRNA that was specific for the spike protein, which is on the surface of the virus. And that was very unique to only SARS-CoV-2 or the COVID-19 virus. And so that was a way to train the immune system when all of us hadn't really seen it before in our bodies, and prepare us so that if we became in contact, that we were prepared with our immune system for fighting that infection.
How important are mRNA vaccines compared to earlier types of vaccines? I mean, are they better?
So we know from our COVID-19 with millions of doses given that they're very safe and they were effective. They helped us decrease hospitalizations. And there's a new JAMA article that shows maybe saved 2.5 million lives during the first 4 years of the pandemic.
2.5 million lives were saved because of these vaccines and the research that gave rise to them.
Right. And I think the nice opportunity that people see with mRNA vaccines is that they're much more quickly produced. Some of our vaccines, like our typical traditional flu vaccine, are grown in chicken eggs and have to be grown and then inactivated and then made into the vaccine to be administered. That can take months, whereas mRNA vaccine can be quickly adjusted, that signal. If there's a variant like we saw with COVID-19, they can adjust what that spike protein coding is and quickly make new vaccines. So they're able to produce many more numbers of vaccine to protect more people quickly.
And we wouldn't have been able to do that using only the more traditional vaccine methodology.
Not in the rapidity that we saw, because really, if you remember back between 2020 when it starts, we had vaccines in early 2021. So
Now, I was talking with you a little before the show. You're a physician. You are an infectious disease specialist, but you see patients. I mean, how big a difference does the availability of these vaccines make for your day-to-day work, seeing people whose real lives are affected by the potential for getting these diseases?
As an infectious disease physician, we see a lot of immune-compromised patients, and those are the people that are still really at high risk for severe either hospitalization, even death from COVID infection, and from other viral infections that potentially mRNA vaccines could be a tool for us to be able to use and protect.
So I want to talk about this federal funding cut and about the impact of that. Nearly $500 million. That's for a lot of different programs, a lot of different research projects going on. Why does this cost so much money to do this research? Why do scientists and medical researchers need $500 million to prepare for something that may or may not ever come, some future infectious disease?
So I think it costs a lot of money because there is research behind it. To bring a product to market, whether that's a medication or a vaccine or a medical device, there's a lot of guidelines and studies that are required to be sure that it's safe and effective. And then on top of that, I think with COVID-19, we saw what a pandemic can do. A worldwide outbreak of illness stresses the hospital systems when we had limited beds, when there were so many extra hospitalizations above what would be expected without the pandemic. We saw lots of people die or have long-term effects from their infection. And so having opportunity to research and be prepared of how these vaccines may help us for future pandemics is very important.
Mm-hmm. I mean, I think it might be hard for a person who's not involved in scientific research to kind of understand what the impact of not having that funding would be. I mean, as you speak with colleagues, as you read about the research and development that was underway or that was planned and now can't go forward, what's that impact going to be? Can you give us some examples? What is not going to happen now that would have happened?
Well, some of the other viruses that they were looking at mRNA technology for vaccines, like cytomegalovirus, which can impact immune-compromised and transplant patients specifically. Other illnesses, they were looking at RSV for that can impact elderly, but also very young children with severe illness. So there's lots of things that still cause issues for individual patients.
Do you worry that we are less prepared for a possible future pandemic, whether it's some re-energized form of COVID or something else entirely? Are we less prepared because this funding's been removed?
So I do think with the funding going away, that research and development definitely probably sets us back slightly because of just needing to have that quick rapid turnaround that we talked about. mRNA vaccines provide a quick response to new pathogens over more traditional vaccine mechanisms of action. But then also just sort of avian influenza. We hear a lot about bird flu.
The bird flu, right, which was important in our area. Farming in Kansas was greatly affected by that over the past year.
Right, and the concern of how if that spreads easily from animals to humans, that could be easily our next pandemic. And so I think having all of our research and development sort of ready to respond, it's never a bad thing to have multiple tools or ways to, hopefully save lives quickly.
I mean, one of the things that seems ironic about this cut right now is that the real big use of mRNA technology to fight COVID-19 occurred during President Trump's first term. In fact, a lot of folks, or even those who are critical of President Trump, would mark that as an achievement of his first term, that this money was poured into mRNA technology, and it was used so successfully to save lives. Robert F. Kennedy Jr., the Secretary of Health and Human Services, has spread a lot of skepticism about mRNA research. Is that something you've noticed in the broader public? Do you hear people being questioning vaccinations in general or this technology in particular?
So I do think there's been a rise in what we call vaccine hesitancy for many years. What do vaccines, being concerned about side effects or long-term outcomes from vaccines? And I think when you have a a large amount of information online and social media, that things definitely spread and people begin to question. And certainly, I think in the long run, it's most important if you have concerns or questions about individual vaccines that might be recommended for you. It's really to have that discussion with your healthcare provider to go over why you need it and how it works and the safety records behind.
As you see it, Dr. Boyd, is there any reason people should be skeptical or hesitant about taking an mRNA-based vaccine for COVID-19 or for something else?
So with COVID-19 vaccine particularly, we have massive amounts of data and lots of patients. That was tracked very closely because it was a newer technology. Those were the first vaccines that sort of got that initial extended use authorization using that technology. And so they're very safe and very effective. One thing that I think comes up a lot with mRNA vaccine is the risk for myocarditis or pericarditis in adolescent males mostly, although younger sort of adolescents. And so certainly that's something to talk about. But the risk of infection with COVID-19 was much higher than your risk of getting that from the vaccine itself.
And the consequences of having COVID-19.
Correct.
So where are we now with that, by the way? I know the CDC has recently announced some changes to its guidelines, its recommendations on who should get COVID-19 boosters or when. Are you still recommending to your patients who come in that they get the latest version of the vaccine each time a new one comes out?
Yes, and particularly those that are high risk for hospitalization or death from COVID-19. So those more elderly, people that have other medical conditions that put them at higher risk, such as emphysema or COPD or diabetes, and those that have transplant or very immune compromised patients.
And for those who are not in those high risk categories, are you still recommending folks do it? Is there any reason not to go ahead and get the latest vaccine each time it becomes available?
So when you look at most of the high risk factors it's very hard to almost not have a risk factor for COVID-19 to have a worsened outcome. And so certainly I would recommend that they talk to their medical professional and go over their personal need of when they need a vaccine and how often.
You know, when the NPR reporter who was working on this last week talked to public health experts around the country, they used some pretty dramatic language to talk about what they think the impact of these funding cuts would be. One of them said, "This may be the most dangerous public health judgment I've seen in my 50 years in the business." Another one said, "It leaves the country vulnerable." Do you feel the same way about this? Do you think the country is being made vulnerable to disease, to pandemic, to serious medical risk because of this funding decision?
So the funding that leads to the research and development, there's so much research that goes into being able to confidently then say, yes, this works well, this is safe and effective for whatever virus or other illness that you're potentially studying. And having that information up front and early instead of in kind of hindsight or a quick response when you have a pandemic outbreak and things are sort of, the pressure is there to do something. I think it's important to have that information and to use the science behind that to make the best recommendations.
We talk about these big national stories. They're political stories. They involve the names that we hear on NPR every day. I want you to help us understand this from a local perspective as a doctor who works in a hospital and sees real people day in and day out. How do you see the impact of these kinds of decisions on the lives of people that you work with as a physician here in Kansas City?
So vaccines are one of the best development in infectious disease, being able to prevent something before you either have severe outcome or you die from something. And when you look at a lot of our different things, not just the COVID mRNA discussion, but polio, we've had measles outbreak in the U.S. this year. All of those things come with consequences for individual patients. And I think having the opportunity to provide vaccination that's safe and effective, to lose that opportunity definitely sets you back. And when you have large outbreaks, that then also leads to other people getting infected that might not have. people that might not respond to a vaccine. We talked about herd immunity a lot during the pandemic.
Right.
That some people can't mount a response to a vaccine, and so having a high level of vaccination protects the community around.
Are you concerned about the immunity of the herd around here at the moment? Are you concerned that we may be more susceptible to anti-vax leanings, to this hesitation you talked about, this vaccine hesitancy?
Yeah, certainly from measles. I was lucky enough to be here earlier this year talking about measles.
Yes.
Or unlucky enough to be talking about measles again. But we are not at kindergarten vaccine rates to provide herd immunity for measles. So,
which was a disease we basically had almost conquered and eliminated from our population.
It had been declared eradicated from the U.S., and so it was usually cases coming in of people who acquired it during travel. But once they're here, if the herd immunity, that higher level of protection isn't there, people here are still susceptible, and you'll see them become ill.
So, as you see it then, Dr. Boyd, what is the way forward? Obviously one might hope in your position that the funding is restored, but are there other alternatives? Is there something else that the medical research community is now doing to try to keep people safe?
I think using the vaccines that we have and having those discussions at individual patient levels to help with some of the concerns or questions that people have when they're considering vaccination is critical. And then I think on a larger community scale, being aware of what's going on, being aware of the national news or international news, being able to speak up about supporting medical and scientific research is important for everyone.
That's Dr. Sarah Boyd. She's an infectious disease specialist with St. Luke's and has been a return customer here at Up to Date to help us understand what's going on in the medical research world. Dr. Sarah Boyd, thank you so much for being here.
Thank you.